Good morning, everyone. Before I begin my presentation, allow me to introduce myself. My name is Harlan and I am a fourth semester student of the nursing study program. I am going to talk about diabetes mellitus. There are 6 points I am going to discuss. Point 1 is diabetes as one of the leading causes of death globally. Diabetes mellitus, the 9th leading cause of death globally, is connected to the hospital load. Hospitals often have a big number of diabetic patients seeking diagnosis, treatment, and care. Point 2 is the definition of diabetes mellitus. Diabetes mellitus is defined as a metabolic disorder in which the body's ability to produce or respond to insulin is impaired, resulting in elevated blood glucose levels. Point 2 is the types of diabetes mellitus. There are 3 types of diabetes mellitus. Type 1 diabetes is an autoimmune condition where the pancreas can't produce insulin and requires lifelong insulin therapy. Type 2 diabetes is a metabolic disorder due to insulin resistance and insufficient insulin production. Gestational diabetes occurs in pregnant women due to hormonal changes affecting insulin production, resolves after birth but increases the risk of type 2 diabetes later. Point 3 is the signs and symptoms of type 2 diabetes. There are several signs and symptoms of diabetes mellitus such as increased thirst, polydipsia, increased hunger, polyphagia, unexplained weight loss, fatigue, increased urine output, polyuria, blurred vision, slow healing, and numbness. Point 4 is the risk factors of diabetes mellitus. There are 2 risk factors of diabetes mellitus. The first is modifiable risk factors that we can change like weight, physical activity, and healthy lifestyle choices. The second is non-modifiable risk factors that we cannot change like family history, age, ethnicity, and gestational diabetes. Point 5 is the treatment of diabetes mellitus. Type 1 diabetes mellitus can be treated by insulin injection. Oral medications can treat type 2 diabetes mellitus. Lifestyle modifications can also treat diabetes like a balanced diet with controlled carbohydrate intake, physical activity like regular exercise to help lower blood sugar levels and improve insulin sensitivity, and weight management to achieve a healthy weight. Point 6 is the diagnosis of diabetes mellitus. Type 2 diabetes can be diagnosed by hemoglobin A1c, HbA1c test, fasting blood sugar test, oral glucose tolerance test, and random blood sugar test. That's all about my presentation and thank you for listening.